I'll introduce myself. I'm Christy Smith. I work at Maine General Medical Center's ER. You guys have questions about meningitis?
Yes. So what do you know about?
So meningitis is what it is the inflammation of the lining between the spinal cord and the brain and the in between. It is called the meninges. We see quite a few people a month with it actually, especially during flu season.
Do you know how it's transmitted?
It's droplets, so sneezing, anything, mucus, coughing, make sure you cover and cough to prevent it.
What?
It's okay, go ahead.
What do they typically present with signs and symptoms? What are they?
Headaches is a big one, stiff neck, sensitivity to light. A lot of babies are seen lethargic, lifeless looking, because obviously they can't tell. But babies, anyone under 30 days, we have to do a spinal tap for, just to test them because they don't have the meninges. Yeah.
Do you know the gram stain of the bacteria?
The one that you guys are studying is gram negative.
Yeah.
Okay.
Foci.
Yep. And sometimes it's encapsulated, sometimes it's not.
Yes. Yeah. And it's non-motile.
Yep.
Do you know how they generally test for it?
They do blood cultures a lot of times, and we do a lumbar puncture to just check for. We analyze the spinal fluid.
Do you know about the epidemiology?
The epidemiology. So it is mostly seen with poor hygiene. In African American usually, so a lot of these southern-ish states see a lot more of it than we do.
Do you know what the treatment is?
I know we use penicillin was a big one.
Yes.
But we actually are using a lot of cephalosporins, Rocephin, mostly in the hospital.
Do you know how the penicillin works?
How it works?
Yeah. It just basically weakens the cell wall of the bacteria and breaks that down.
Okay.
What about the side effects of the treatment?
So the side effects are going to be more your side effects of any antibiotics, headaches, diarrhea, nausea, vomiting. Of course, you want to make sure that you're seeing signs of improvement in these patients.
What about non-pharmaceutical treatment or like patient education we can use?
Patient education, you're going to want to teach signs and symptoms of worsening meningitis, because there's cases where you need to trade out your antibiotics if one's not working. So you're going to want make sure that you're seeing signs of improvement, and if you're sending them home, that they're seeing signs of improvements. As far as patient education for symptoms, any antibiotic can cause nausea, vomiting, diarrhea, and that's something non-pharmaceutical that they're going to have to treat on their own. Make sure they're drinking fluids, make sure they're washing their hands, make sure that if they're in contact with any of their family members, that their family members have to be treated as well, prophylactically.
What age group do you typically see this in?
We have seen lately a lot of babies, but we usually see you're supposed to get your vaccinations at 11 and again at 16. So usually earlier or much later, 30s, 40s.
Do you know what the name of the vaccination is?
You get your Hib as a baby, and the second one you're going to have to remind me its initials. H. Do you know it? Do you have it right now?
The MCV4.
Yes.
Yeah.
Yep. So you get that at 11 and 16, and make sure your Hib is giving it 2, 4, 6 months, and then a booster at 12 to 15.
Awesome. So besides, there you go.
Besides babies, it's also common in people who are immunocompromised. Right?
Yes. Yep. And even with HIV, cancers.
So there are some common side effects. Do you know some severe side effects in which you should seek medical attention?
As far as
like with the treatment
of antibiotics?
Yeah.
So lethargic, you can watch for lethargia of patients, dehydration, increased dehydrations,
Any allergic reactions?
yes, rashes, hives, difficulty breathing.
Yep.
Anything else you'd like to know? Or?
Is there more questions?
Yes, that's it.
Perfect. Thank you.
Thank you.
Alright, hello, my name is JT Green. I am a business student here at Hudson. I'm in my third year and it's going well so far. Really enjoy it.
We're nursing and pharmacy students.
Good, nice to meet you all.
Nice to meet you.
So do you know anything about meningitis?
I know that it's not very good, but that's about it, I would say.
Okay, so basically what it is it's the inflammation of the meninges. Do you know what that is?
No.
It's like the lining of your brain and your spinal cord.
Okay.
So it's really dangerous. Do you know how it's transmitted?
Is it, no, I'm not sure.
It's like through someone's infected, coughing, kissing someone.
Secretions.
Yeah.
Okay.
So if you know anybody with meningitis, don't kiss them or don't let them cough near you. It's a lot less like contagious than like germs from a cold. So you're less likely to catch it even if someone like coughs on you. But it's still.
So it's not like an airborne thing, I suppose?
It is an
Gets
airborne
in the air,
thing,
yeah,
but
secretions.
it's not as common as like a cold, which is like 200 serotypes of a certain virus.
And then the reservoir will be in your nasopharynx. Do you know where that is? It's like behind your nose, yeah, but above your throat.
Do you know how it's treated?
No.
Okay, so
I'm assuming through antibiotics.
yeah.
Yes. Yeah.
Yeah, you're right. So it's either going to be IV antibiotics or a short-acting muscular antibiotic. So, and it's usually penicillin G. Yeah. And they can do antibiotic therapy before the diagnosis because it's better to treat it prior to and getting right on it than waiting for the results and waiting to start the treatments.
Okay.
Do you know how the penicillin would work?
No.
It would basically break down. So this bacteria, it's a gram-negative bacteria and it's spherical shaped, and it would break down the cell wall of the bacteria. Yeah. Do you know any adverse effects of the treatment?
I don't.
You can have diarrhea, headache, pain, or swelling. But if you have any severe stuff like an allergic reaction or anything, then you should seek medical attention.
And for signs and symptoms, you want to look for headache, fever, sensitivity to light, and stiff neck. You can have vomiting, nausea, and in a child, they cannot tell you, and there's no way to know, like, from them telling you. So you have to look at, they'll either be irritable, kind of just sluggish, they won't be feeding well. That's how you would tell with an infant.
I'm sure it'd be really difficult to tell with an
It
infant.
would be, yes, yes.
It's more common in like little kids and babies, and also in people who are immunocompromised, like if they have cancer or HIV, just because their immune system isn't as fully functioning as a healthy adult. It's also more common in Africa because they don't have access to the vaccine and proper health care.
Do you know what the vaccine is?
No.
I assume you've gotten it. It's called MCV4.
Okay.
You've probably gotten it around
probably
like 11 or
have.
12.
Do you know how they test for it?
Nope. Much
So they do blood cultures, and then they also sometimes have to do a spinal tap and test the cerebral spinal fluid that's in your
Wow.
brain and your spinal column.
Yep.
And if it comes out cloudy, then you know that there's something wrong. But if it's usually because your cerebral spinal fluid is clear.
Wow. It's just an alert. I did not know that.
So some ways you can prevent it, of course, is getting your vaccination. Just good hygiene, taking care of yourself, sleeping, being hydrated, washing your hands frequently. Don't share food and beverages with others.
Or toothbrushes.
Oh yeah.
Share a toothbrush.
Yeah.
Do you have any questions for us?
Going back to what you said earlier, you were giving the symptoms. So you just gave the symptoms of the of the treatment.
Yeah, some side
I'm just trying to
effects.
clarify. These
Yeah.
are the symptoms of like meningitis itself.
Meningitis.
You were
Yeah,
talking about side
and I was
effects.
talking about the side effects of the treatment.
Yeah, with the meningitis, it would be headache, fever, stiff neck, nausea,
Mhm.
vomiting, which some of that.
Which some, yeah, they are
They
very
kind of
similar.
are,
Yeah.
You could have some confusion, sensitivity to light. With a baby, like I said, they'll be irritable, fussy, kind of sluggish, not eating well.
Mhm.
With the treatments for women, usually, you'd have to find a different form of contraceptive because the oral contraceptive will become less effective throughout the treatment.
And you also want to be aware, if you're a female and you're taking it, that it can pass through the breast milk.
Oh, okay.
It's unlikely to harm the child, but
But
just be aware. Yep. Any questions?
that was pretty insightful.
Thank you.
Thanks, guys.
Thank you.
Thank you.